Have you ever heard of a medical condition so strange that it makes you question reality itself? What if I told you that some people believe they are dead or do not exist at all? This is the bizarre of this strange syndrome, a rare mental health disorder that can leave both patients and their loved ones bewildered. In this video, we will dive deep into the fascinating world of this bizarre medical condition. You'll learn about the symptoms that characterize this unusual condition, including the profound feelings of nihilism and the belief that one's body is decaying or no longer alive. We'll explore real-life cases that illustrate the impact of this syndrome on individuals and their families, shedding light on the emotional and psychological toll it can take. Understanding such rare conditions is crucial, not just for medical professionals, but for all of us. By raising awareness about this syndrome and similar disorders, we can foster empathy and support for those affected. Additionally, learning about these bizarre medical phenomena can help demystify mental health issues, encouraging open conversations and reducing stigma. So stay tuned as we unravel the complexities of this bizarre medical condition and discover why it's essential to understand these extraordinary conditions. Symptoms. It is often referred to as walking corpse syndrome, is characterized by a profound and unsettling belief that one is dead or does not exist. Patients may express feelings of being lifeless, leading them to withdraw from social interactions and daily activities. This overwhelming sense of non-existence can be incredibly distressing, not only for the individuals experiencing it, but also for their loved ones who struggle to understand their reality. In addition to the core belief of being dead, individuals with Cotard Syndrome often suffer from severe depression. This depression can manifest as a lack of interest in life, feelings of hopelessness, and an inability to find joy in activities that once brought happiness. Delusions are another significant symptom, where patients may have distorted perceptions of their bodies, believing they are decomposing or have lost vital organs. These symptoms can severely impact daily life, making it challenging for individuals to perform even the simplest tasks. Routine activities such as eating, personal hygiene, and socializing can become overwhelming. The isolation that often accompanies Cotard Syndrome can lead to further deterioration of mental health, creating a vicious cycle that is difficult to break. Understanding these symptoms is crucial for providing appropriate support and treatment, as well as fostering compassion for those navigating the complexities of this rare condition. Prevalence and impact. Cotard syndrome is an exceptionally rare condition, with estimates suggesting that it affects approximately 1 in 100,000 people annually. While this may seem like a small number, it is essential to recognize that the true prevalence may be underreported due to the stigma surrounding mental health issues and the lack of awareness among both the public and healthcare professionals. Research indicates that Cotard syndrome tends to occur more frequently in individuals with underlying mental health disorders, particularly those suffering from severe depression or psychotic disorders. It is most commonly diagnosed in middle-aged adults, although cases have been reported across various age groups. The demographic most affected often includes individuals who have experienced significant life stressors or trauma, which can trigger the onset of symptoms. The significance of awareness and recognition of Cotard syndrome cannot be overstated. Increased understanding of this rare condition can lead to earlier diagnosis and intervention, ultimately improving the quality of life for those affected. By educating both the public and healthcare providers about the symptoms and implications of Cotard syndrome, we can foster a more supportive environment for individuals grappling with this distressing disorder. Raising awareness also helps to reduce stigma, encouraging those who may be suffering in silence to seek help and support. In a world where mental health is increasingly prioritized, understanding rare conditions like Cotard syndrome is a vital step toward comprehensive care. Fatality rate. Cotard syndrome, while primarily a mental health disorder, carries significant risks that can lead to severe complications, including a heightened potential for self-harm and suicide. The belief that one is dead or non-existent can drive individuals to neglect their physical health, leading to malnutrition, self-neglect, and other dangerous behaviors. Although specific statistics on the fatality rate associated with Cotard syndrome are scarce, studies indicate that individuals with this condition may have a higher risk of mortality compared to the general population, particularly due to associated mental health issues. Research has shown that patients with Cotard syndrome often have comorbid conditions, such as severe depression or psychosis, which can further complicate their health outcomes. A study published in the Journal of Affective Disorders highlighted that individuals with Cotard's syndrome had a notable incidence of suicidal ideation and attempts, emphasizing the critical need for effective intervention strategies. The importance of early diagnosis and intervention cannot be overstated. Recognizing the symptoms of Cotard syndrome promptly can lead to timely treatment, which may include psychotherapy, medication, and supportive care. Early intervention can significantly reduce the risk of complications and improve the overall prognosis for individuals affected by this rare condition. By raising awareness and understanding the potential risks associated with Cotard syndrome, we can better support those in need and work towards reducing the associated mortality rates. Treatment and cure options. When it comes to Cotard syndrome, a multifaceted approach to treatment is essential due to the complexity of the condition. Various treatment methods have shown promise in alleviating symptoms and improving the quality of life for those affected. Psychotherapy, particularly cognitive behavioral therapy, CBT, is often employed to help patients challenge and reframe their distorted beliefs about existence and self-worth. This therapeutic approach can provide individuals with coping strategies and emotional support as they navigate their feelings of nihilism. In addition to therapy, medication can play a crucial role in managing Cotard syndrome. Antidepressants, antipsychotics, and mood stabilizers are commonly prescribed to address underlying mental health issues such as severe depression or psychosis. The combination of therapy and medication often yields the best results, allowing patients to regain a sense of reality and improve their overall mental health. Mental health professionals are vital in managing Cotard's syndrome, as they provide the necessary support, diagnosis, and treatment plans tailored to each individual's needs. Their expertise is crucial in monitoring progress and adjusting treatment strategies as required. Ongoing research into Cotard syndrome is exploring new treatment modalities and understanding the neurobiological underpinnings of the condition. Advancements in brain imaging and neuropsychology may lead to more effective interventions in the future. By staying informed about these developments, we can hope for improved outcomes for individuals grappling with this rare and challenging syndrome. Cotard syndrome. In summary, Cotard syndrome is a rare and perplexing mental health condition, characterized by the belief that one is dead or does not exist. Key symptoms include profound feelings of nihilism, severe depression, and delusions about one's physical state. Although the prevalence of this syndrome is low, affecting approximately 1 in 100,000 people annually, its impact on individuals and their families can be devastating. Treatment options for Cotard syndrome typically involve a combination of psychotherapy, such as cognitive behavioral therapy, and medication to address underlying mental health issues. The role of mental health professionals is crucial in managing this condition, as they provide the necessary support and tailored treatment plans to help individuals regain a sense of reality and improve their quality of life. As we conclude our discussion, it's essential to remember the importance of mental health awareness. Understanding rare conditions like Cotard syndrome not only fosters empathy, but also encourages those who may be suffering to seek help. By raising awareness, we can work together to reduce stigma and promote mental well-being. If you found this video informative, please consider subscribing to our channel, liking this video, and sharing it with others who may benefit from this knowledge. Your support helps us create more content that raises awareness about mental health and other fascinating topics. Thank you for watching, and stay tuned for more insightful discussions.